Transcervical resection of septum is a very rewarding procedure for the septate uterus. Lady who has recurrent abortions will be subjected for the hysterosalpingogram. It can be screened by the normal 2D scan for the presence of a well-formed fundus to rule out from the arcuate uterus. The 3D sonography and the MRI pelvis can be done so that we can very well confirm that this is a septate uterus, not the arcuate uterus. Then we can subject directly for the transcervical resection of the septum, either by the cold seizures or by the working elements or the cutting elements, either monopolar or the bipolar with the normal saline. The advantage of doing with the seizures, the cold seizure, is that there will be less thermal damage to the tissue and better recovery and better formation of the endometrial cavity will be there. But one disadvantage is that if there will be one bleeding vessels will be opened, then the procedure may have to be about. We can go with the bipolar working element. In that, it is a very safer one, but only problem is that the problem of the working media and the cost of the working element, additional requirement of the working element. So conventionally, unless the septum is very wide and vascular, we usually do with the cold seizures, and that gives a very good satisfying result. Look at the beautifully formed uterine cavity after the procedures, and the lady will be gifted with the pregnancy afterwards. Thank you all.